Hi everyone, this is Dr. Beecher and welcome to another Tooth Talk Thursdays. Alright, today is gonna be a short video, okay, because we're doing this a little late because today was a very busy day. But I hope you guys are enjoying the weather. Hope you guys are enjoying the increased mobility. Alright, hope you guys are still social distancing and staying safe. Alright, so today we're gonna talk to you about blood thinners. So they're basically two types of blood thinners, but before we get into that, if you're on blood thinners, please tell your dentist. Number one, risk of bleeding. Number two, interactions with medications we could prescribe for you. And number three, risk of bleeding. So there are two major types of blood thinners. You have your anticoagulants and you have your antiplatelets. Not going to go into the details of all of those differences as it may be a little complicated, but I'll tell you. So some of the more common ones, the anticoagulants that you may be familiar with, are Warfarin, Heparin. The newer ones, you have your Xarelto, you have your Eliquis. The antiplatelets, of course, the most common one is aspirin. Then you have your Plavix and Plagril, right? And one that you may not even think about is garlic. And the garlic itself may not be so bad in terms of your bleeding risk, but if you're taking any of these other medications and you take a lot of garlic as well, then that will increase your risk for bleeding. Right. So patients on blood thinners, you'll be on blood thinners if you have a risk for heart attack, risk for stroke, if you've had a heart attack or a stroke before, if you have had deep vein thrombosis, if you have had a pulmonary embolus, anything that basically a clot caused some issues with you, right? Also, if you have had a valve replacement, or if it's right after surgery to reduce your risk of clotting. So those are the patients who are normally taking blood thinners. Right, so in terms of dental procedures that may cause bleeding, it's just about anything. Cleaning, especially deep cleaning, if you know that the gums are inflamed, even a simple cleaning can cause the patient to bleed quite a bit afterwards. Of course, extractions. Of course, any type of surgical procedure will also cause a patient who is on blood thinners to bleed. So, and of course, things like implant placement would fall under that. So if you are taking blood thinners, the first thing we would need to do before we do any procedure for you is to obtain medical clearance. All right, usually from whoever put you on the blood thinners. All right, most commonly a cardiologist. So based on what you're taking, there are three options. They may choose to stop the medication, they may choose to reduce the dose of the medication, or they may choose to do nothing at all. So it's very important for you not to take it upon yourself to stop any kind of blood thinner, because there's always a risk-benefit analysis that has to be done. So with the risk of you having an incident where you have a stroke or if you have a heart attack, you weigh that against the benefit of whatever dental procedure you need to do and the likelihood of you bleeding quite a bit from it. So, as I said, you need to get medical clearance from the doctor and they will decide on the course of action. Of course, I'm not going to go into details about, what course you use or what medication, because we don't really want you messing with your medications yourself. In terms of how we manage you in the dental environment, there are several things that we can do. Once, if your medication has to be altered, if they're going to keep you on the medication, there's still things we can do to reduce bleeding, right? You keep pressure on the wound, we can stitch it, there's stuff that we can let you rinse with, so there's nothing to really worry about, right? But the key is for us to just liaise with the doctor and ensure that the best thing is happening for you. Now, if you're on one of the more complicated blood thinners like the Warfarin, you may have to do a blood test called an INR, right? And you may you do that close to when you have. What's going on with my internet? Yes, I don't know what happened with my internet. Thank you, Flo, again. So you may have to do your INR or clotting time test, right? But your doctor would be the one that would prescribe all of that for you, and you would get that done and carry it soon after to your dental appointment, and we will work with you. All right. So that's it for today on blood thinners. Have a good day. Enjoy the rain. Bye.